Dr. Shark here, Shark Holistic Health. This is our lab series. I want to talk about full thyroid panel with antibodies. So a lot of patients who come to me have had some thyroid labs already run because they have fatigue or hair loss or weight gain or some combination of those things, brain fog, and their doctors thought, oh, maybe this is hypothyroid. However, most doctors will only run two labs, TSH and T4, or just TSH, right? And then if the TSH is off, then they'll run the individual thyroid labs. Most of them will never run the antibodies. So when we run a thyroid panel, we want to run an array of thyroid labs. TSH, T3, T4, total T4, reverse T3, free T4 index, and then we also want to run antibodies. TPO antibody, TSH antibody, thyroglobulin antibody. Why? So when we're looking at the thyroid, the TSH can frequently be normal when the hormones are off. So first of all, we want to know if the hormones are off. If they are, we're going to look at what's the underlying issue in the endocrine system. Second, one of the most common reasons that the hormones are off is autoimmunity. And so in Western medicine, frequently they don't bother looking for autoimmunity because they don't really have an effective treatment for thyroid autoimmunity. It's not one that you typically get put on immune suppressors for. So the treatment is just to replace thyroid hormone. So there's no value in diagnosing thyroid autoimmunity. From our standpoint, there's a huge value, and that is that if the problem is autoimmunity, the problem is not the thyroid, it's the immune system. And so the focus needs to be on the immune system and what is driving the autoimmunity, not on thyroid hormone levels so much. And that is critically important to understand. The other is, if you do have Hashimoto's, which most people are going to have the TPO antibody positive, if you do have Hashimoto's, studies have shown that people with Hashimoto's should not eat gluten because gluten triggers an increase in Hashimoto's antibodies. And so if we see this kind of antibody activity on your blood test, we're going to recommend that you be permanently gluten-free, because every time you eat gluten, it's going to drive those antibodies to attack the thyroid, upset the thyroid level, and then upset all kinds of other things in the body. Because the sad thing is, Hashimoto's antibodies don't just attack the thyroid. They also attack the brain tissue and the myelin sheath. And so if you have these antibodies, it's really important that you get them under control and that you don't trigger them to go into hyperdrive. Because when they run out of thyroid to attack, they start attacking the brain and the myelin sheath, creating neurological problems. And the last thing we want anyone to develop is neurological problems, right? And so it's critically important that we understand if autoimmunity is there, if there is thyroid dysfunction, and what the underlying root issue is so that we can start treating.